In 2018, the Explainable Machine Learning Challenge ran at the annual Neural Information Processing Systems Conference. This contest was a case study on the trade-off between black box models, where decisions are reached directly from an algorithm's interpretation of data and cannot be replicated or understood by its human creators, and more interpretable models. There's a prevailing theory in the computer science field that accuracy must be sacrificed for interpretability. At the awards ceremony, conference attendees were asked to engage in a thought experiment. You have cancer and you need surgery to remove a tumor. You have two options: a human surgeon who can explain anything to you but has a 15% chance of fatal error, and a robot arm that you cannot interact with and must place your total trust in, but has a 2% rate of failure and death. All but one attendee chose to place their life in the hands of the robot. In a paper by Cynthia Rudin and Joanna Radin, they questioned the false dichotomy the thought experiment presents between the accurate black box and the inaccurate glass box. When you trust the black box, you trust the unknown, and you lose the ability to question the algorithm, the weighting mechanisms, the database, the analysis of that database, and so on and so forth. Algorithmic usage in healthcare is often a black box, and this becomes an issue because it results in racial bias flying under the radar of algorithmic objectivity. A 2019 study published in Science found that a healthcare risk prediction algorithm used to assign high-risk care management with greater access to nursing staff and more primary care visits resulted in racial bias because it relied on a proxy method of correlating cost and healthcare needs. When the outcomes of the algorithm were analyzed, they found that Black patients tended to receive lower risk scores. Because Black patients' recorded healthcare costs were on par with healthier white patients, they were not flagged for high-risk care management. Even when they had spent the same amount, they were perceived to have different levels of need. This halved the proportion of Black patients who would have received extra care. While the researchers were focused on analyzing one specific tool, the same flaw was present in 10 of the most widely used healthcare algorithms, affecting between 150 to 200 million people in the United States.